I'm Tamara Ugolini here with Rebel News to bring you the continued devastation that knee-jerk, unscientific COVID-related policies have had on people. Such is the case with Robin Bigger, who I will be interviewing in just a few minutes. But first, some background. Robin Bigger is a married mother of 4 who was working at Niagara Health in Ontario for nearly a decade when she was terminated due to the denial of a sincerely held religious exemption to all vaccinations, not just the novel COVID-19 injection. Bigger worked in medical device processing, which means that she had no direct patient contact. She was responsible for sanitizing equipment between procedures, such as if you were in for stitches or were having a baby. Bigger was hired by Niagara Health in 2014 with a documented religious vaccine exemption on her file. It was part of her hiring contract. But in light of COVID-19, it no longer holds any merit. And joining me now to discuss how exactly this came to be is Robin Bigger. Check it out.
So I actually was hired in 2014, and at the time of hire, you have a sit-down meeting with occupational health, and obviously they go through all sorts of safety to work at the hospital. And obviously one topic that came up was vaccination. And so at the time, I was not up to date on my vaccines. And I was prepared at the time that I probably won't get the job. But through conversation, I was presented with a form that was titled Refusal of Vaccination. And so I signed the form and I was hired. And so I've been working with Niagara Health since 2014, not vaccinated.
And I guess in 2016, you had told me that there was some sort of severe respiratory outbreak that happened. How were you treated at that point in time?
Correct. So I believe it was around 2016, there was a really bad respiratory outbreak that had, so actually Niagara Health does have a long-term care unit. And at the time I was also working in housekeeping. And so there was a terrible flu outbreak. There was a respiratory. And I had already been working for, I believe, 2 or 3 weeks. And it had been brought to everyone's attention that I did not have the flu shot. And so I was approached by my manager that I couldn't work. And so I do know, working in healthcare, that meant I would have to go home. I would have to isolate for, I think it was 10 days, and then I could return to another part of the hospital. So I did have a meeting with, my manager did go down and speak with OC Health, and he came back to me and said, you need to take the flu shot, which at the time I did obviously refuse. And so he left me again on the floor, and then he returned and said that I was fine to work. I just first needed to go speak with OC Health. So they did actually give me a prescription for Tamiflu, and told me that if I'm going to work in the outbreak, that I would have to take the Tamiflu. And at the time I did say I would speak to my doctor to make sure that that was something for me to take. And I just continued working.
So what happened then throughout the COVID hysteria? Why was this protocol entirely disregarded? And I guess tell us how you were treated that point forward.
So, I mean, there was so much going on, obviously, working in healthcare. And at the beginning, obviously, when COVID happened, everyone was scared. It was everything that we were hearing was, we're all going to get sick. We're probably all going to die. And I had actually just lost my mother. Sorry.
No, I'm sorry to hear that.
Pardon me. She passed in January, so that's how new that was. And so obviously I was fearful, and I was following all the guidelines that they had presented to us in regards to PPE and how to keep ourselves safe. And I mean, I'd worked in the hospital at that point for a long time, and so I knew I just had a general practice, hand washing. And so it wasn't, but you're hearing on the news of all these crazy implementations that the hospital was putting in place of, we couldn't sit beside each other in the lunchroom, and obviously the social distancing, and it was just kind of striking me, this is so odd. Like, it just did not make sense to me what was going on. And so obviously I was watching the news, and you're hearing things rolling out and how companies were being asked people to work from home, and I was hearing more and more of a vaccine. And I thought, oh my gosh, that's the one thing. Sorry, that was the one thing I knew I was not going to be able to do. And so at the time I thought, but that's okay, because the hospital already knows this. They know this about me. They know where I stand. They know what I believe. And so I actually didn't think that it was going to be an issue for me, that I might have to have a sit-down conversation at some point with a manager or with Oc Health and just go over again why I didn't take any vaccines. But in my head, I thought I've had this conversation. And so I did. I felt like as long as I followed I did all the online training. I completed, we had to complete this online course of these new vaccines and what they meant for us. And so I did, I completed all that. So it was when Directive 6 came out, which I believe was August 2021. And I kind of had a moment of, it's going to be okay though, because the government actually was not mandating this for healthcare.
You couldn't, if the school didn't want you to come to the classroom at a university or college, then you would be allowed virtual. So in our vantage point, we wanted it to be a policy framework rather than a mandate, and we did not have a mandate in Ontario from this government's vantage point.
And then when Niagara Health released their policy, and they did say that it was going to be mandatory, I knew that this was not going to probably go well for me.
And it did not go well for Bigger, because the hospitals and associations were now armed with Directive 6, which, yes, always stipulated accommodation for vaccine exemptions, but also laid the groundwork to disregard said exemptions and instead institute indiscriminate vaccine mandates, which Niagara Health did. Listen to this clip of Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, in August of 2021, when he was enabling this behavior, which he continued to do over the months that followed.
I can understand, though, in certain healthcare settings where the vaccination rates may have been low for workers, that hospitals have stepped up and put in policies to protect their patients. That seems appropriate to me in those settings. And some universities are stepping up by saying they would like individuals to be immunized to come on campus. That makes sense to me from a public health vantage point to protect the campuses, because we know that age group has the highest rate now of disease and some of the lowest immunization rates. So I thank them for encouraging individuals to come forward. But as a province, we are doing very, very well and keeping up with the national rate of immunization. I do think as we head into September, our numbers will come back and will continue to accelerate beyond 81, 82%. And again, celebrating 20 million doses being provided to Ontarians.
And after months of fear and reinforcement of such aggressive discriminatory measures from government bureaucrats and health necromancers, Niagara Health announced their vaccine mandate on October 2021, which would take effect January 27th, 2022. And oddly, on January 6th, they postponed the firing of their unvaccinated staff, who were once hailed as frontline heroes due to, I guess, Omicron, because after 1 year of hospital staff dancing with desolate emergency departments in their midst, it was only after the miraculous injections rolled out that these hospitals became overwhelmed.
Many of us were traumatized with what happened in January, February, and March of 2021, where there seemed like there was no escape from this.
You see, the real-world data was contradicting the narrative of safe and effective, which is why places like Public Health Ontario stopped publishing data sets on hospitalizations, cases, and death rates based on vaccination status in the summer of 2022. And despite the fact that Biggers' signed employment contract involved a vaccine exemption predating COVID, her employer went full health authoritarian. But even still, she tried to jump through all of the hoops to obtain a religious exemption once again. Hear it from her.
Printed up the form. I did write a religious exemption, which felt so odd to me that I was trying to convince somebody that my beliefs were longstanding, they were sincere. I mean, you could have asked any of my coworkers and they would all probably absolutely speak that they knew me as being a very strong Christian woman. And so my original exemption that I wrote, I submitted it, and at the time I did ask for, like, what is the criteria that you're looking for? Because obviously this is a first time for everybody. First of all, having to read one, and second of all, you know, how are these people trained? Like, what are they looking for? Like, what if I miss something that I probably could answer? And they wouldn't give me that information. And so I submitted it, my first exemption. And then after about a couple of weeks, I thought, I'm going to write a follow-up, because I didn't, to me, I felt like I was pleading with them. Like, just, I need you to believe me. I mean, I was asking them to believe my faith. And so I wrote a new one, and that one kind of, you know, I included a life story and how long I've been involved in my church, and how I serve my community and my family and my kids. And so that one I did submit at the time to the president and I believe it would be the CEO of the hospital. And I did ask them, you know, if they would personally respond to me. And again, I just don't know what you're looking for. And it was just a thank you. We've received it. We will review it. And in November, I received a letter of denial, just saying that my beliefs did not reach the threshold.
And so it goes that Niagara Health wanted all of Biggers' information, but of course would not share or clarify any of their own. So naturally, I reached out to the media contact for Niagara Health, which is Erica Beyer, with some questions. I asked, what is the current COVID-19 vaccine policy for staff at Niagara Health, and where can it be found online? What science was used to determine that COVID-19 vaccines reduce illness and or severe outcomes? And I hyperlinked to their website where they state that. Did Niagara Health go above and beyond now rescinded Directive 6 with indiscriminate COVID-19 mandates, and if so, why? If not, how many vaccine exemption requests were approved? How long will this policy remain in place, and how is the success or efficacy of this policy measured and or determined? How does this policy align with the diversity, equity, and inclusion goals of Niagara Health? As is this hailed new normal, no one responded to the media request. As for Biggers, she is left grappling with mounting legal bills as she files both a human rights tribunal case for religious discrimination and goes through the grievance process with her union for wrongful termination.
Like I had said, I had truly just wanted to keep this private. I'm not sure why, but I did. And just my husband and I are realizing the financial burden of taking this on independently. And I mean, the hospital has a never-ending amount of money and lawyers. And so it's important, I think, I need to see my case to the end, because regardless of whether I win or lose, I have children. Many of us have children, many of us ourselves, and have family members who are not fully vaccinated for religious reasons or for their own, beliefs. And they need to be allowed to enter into a workforce unvaccinated because of their beliefs. But currently, the way that things are standing, it doesn't look like something that will be able to happen.
Where can people go to support you and help in your fight?
Well, if you go on Give, Send, Go and you type in my name, I do believe that my crowdfunding page will come up.
If you would like to support Bigger in her fight against religious discrimination and forced medical experimentation and, I guess, apartheid, then I will put the link to the Give, Send, Go initiative in the written component of this report. For Rebel News, I'm Tamara Ugolini. Canceling people out of their field of work and squashing anyone who made a contrarian medical decision to the health establishment's preferences has led society down a dark path. If you agree that doctors, scientists, politicians, and all medical professionals should provide their professional opinions without fear of harassment, slandering, or canceling, then head on over to our petition at stopmedicalsilencing.com and sign it today. Find out more and sign the petition at stopmedicalsilencing.com.